Today we'll talk about the pathology of the breast, and these are the common topics that we are going to discuss today. So, normal anatomy before the puberty, the breast in both sexes doesn't have ducts. There is a variable degree of branching, a lack of lobules, 15 to 25 lactiferous ducts, and it starts in the nipple branch and leads to terminal ductal lobular unit, intralobular duct, multiple lobular ducts, and acini, and is hormonal responsive. At birth, male and female breasts have active secretion due to transplacental passage of hormone, and there is a bilateral breast enlargement, colostrum-like secretion, which is called as witch milk, and recedes after several months postpartum. And after menopause, there is a gradual and progressive involution, lobular atrophy, and increased fat and cystic dilation of the ducts. Macromesia is a diffuse enlargement of both the breast, adolescence or pregnancy, exaggerated response to hormonal stimulation. And in pregnancy, 1 in 100,000 pregnancies, there is erythematous edematous, and it's pain. Aplasia or hypoplasia, it's uncommon, associated with overdevelopment of the contralateral breast, acquired irradiation of chest wall tumors, and unilateral or bilateral amasia, absence of nipple, breast, ducts, and pectoralis major muscle, and it's sex-related. Ectopic breast, supranumerary breasts could be found, and 1 to 6% of the adult women, much less often in men, unilateral axillary breast tissues, and there could be aberrant. Fat necrosis can simulate the carcinoma clinically and mammographically. History of antecedent trauma prior to the surgical intervention. Histiocytes and foamy cells are seen, which are lipid-laden cells, and there could be fibrosis, calcification, and eggshell is seen on mammography. Hemorrhagic necrosis with coagulopathy is warfarin treatment shortly after initiation, and edema, hemorrhage, and necrosis seen. There is protein C deficiency. Breast augmentation, you can see the foreign material, and silicone bag could be seen. Purpural mastitis, early stages, 2nd or 3rd week of lactation, 5% of stasis of milk in distended duct with staphylococci, granulomatous lobular mastitis, etiology unknown, suggested carcinoma, mammary duct ectasia, periductal inflammation, duct sclerosis, intermittent nipple discharge, tuberculosis, less developed regions, serious conditions, lactating breast, and slow growing painless mass. Benign proliferative lesions, pathological spectrum of seemingly related clinically benign breast abnormalities, palpably irregular and pale breast, discrete lumps and multiple nodules, cystically dilated ducts, apocrine metaplasia, interlobar and interlobar fibrosis. And you can see the fibrocystic change and disease. Adenosis is elongation of the terminal ductules, and there's sclerosis, sclerosing adenosis, apocrine adenosis, and tubular adenosis. Non-palpable region recognized in mammograms, and there could be microcalcification or macrocalcification. Fibroadenoma is proliferation of the epithelial and stromal elements, and most common breast tumors in adolescents and young adult women. Higher incidence of the in black patients. Well circumscribed, freely movable, non-painful mass, regress with age if left untreated. Ducts distort, elongated, slit-like structures, intraclanicular pattern, or a periclanicular canalicular pattern could be seen. Tubular adenoma is less common. Young women are involved, and there is uniform sized ducts. Lactating adenomas, enlarging masses during lactation or pregnancy. Intraductal papilloma, and there is subareolar lactiferous ducts, periductal inflammation, and ductal sclerosis could be seen, and bloody discharge in the nipple is common. Cystosarcoma phylloides or phylloides tumor, initial description over 150 years ago, fleshy tumor and leaf-like pattern when it's sliced and sits on the cut surface. Circumscribed connective tissue with epithelial elements, less than 1% of the breast tumors, benign, malignant, low and high grade, and metastases are hematogenous. Proliferative changes, there is ductal and lobular hyperplasia, atypical ductal and lobular hyperplasia, higher risk of cancer than normal population associated with microcalcification on mammography, incidental histological finding, and atypical hyperplasia and precancerous lesion could be seen. Most frequent malignant tumor is breast carcinoma, highest incidence in developed countries, and second most common cause of death, whereas the first most common is lung cancer. Risk factor is genetic predisposition, proliferative changes, and importance of preventive control. So it could be classed as in situ, invasive, lobular, and ductal in situ, ductal invasive, and there are few otherwise could be lobular invasive as well. Carcinoma in situ is a pre-invasive tumor, multicentricity and bilaterally, so we need to keep an eye on them and need to be under surveillance, and there's no metastatic spread and risk of invasion depending on the grade of the tumor. Invasive ductal carcinoma is the largest group and mid to late 50s, stellate, white, firm, less often circumscribed, soft medullary carcinoma, hormonally dependent, uniform cells, infiltrative growth pattern is. Other types are tubular, mucinous, medullary, inflammatory, metastasis, the regional lymph node, axillary, parasternal, and lungs, liver, bones, brain. Treatment is surgery, radical mastectomy, breast conserving surgery, lumpectomy, radiotherapy, and hormonal therapy like tamoxifen and chemotherapy. Paget's disease of the nipple results in the intraepithelial spread of the intraductal carcinoma. Large pale staining cells within the epidermis of the nipple limited to the nipple or extend to the areola. Pain on itching and scaling, redness and mistaken for eczema, ulceration, crusting, and serous or bloody discharge can be seen. Gynecomastia is most common clinical and pathological abnormality of the male breast and increases in the subalveolar tissue and 30 to 40% of the adult male, and associated with medications, hyperthyroidism, chronic pulmonary disease, hypogonadism, estrogen, progesterone, spironolactone therapy. Thank you very much. Hope you have enjoyed the discussion today.